He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Thanks for joining us, folks. As you know, this is the Stay Off My Operating Table podcast with Dr. Philip Ovadia. We are joined today by a guest who was one of our very first, I think, Dr. William Davis. Phil, I'm going to sit back and enjoy listening to you two guys talk.
I think that will be great, and there should be no shortage of things for us to talk about. Really excited to have Dr. William Davis back on with us. Doesn't really need any introduction, and people can certainly go back and listen to the first episode we did with him. I think it's over 2 years ago now, but Dr. Davis is really one of the pioneers in this space, was one of the early ones talking about things like metabolic health and low carb, and has an extensive background as a cardiologist and a researcher. Really comes at this with a scientific mind, and really excited to kind of catch up with him and understand what new developments he's found along the way over the past few years. Before we get into that, maybe, Bill, just maybe a brief background for people who might not be familiar with you, although I would be surprised if there are many of them in my audience that haven't come across your work since I've built upon it so much.
I suppose I could call my podcast Stay Off My Cath Lab Table. So that, like you, I came from that world where I was doing a lot of heart catheterizations and angioplasty, stents, and all that sort of thing. My mom died of sudden cardiac death about 4 months after receiving a 2-vessel coronary angioplasty in New Jersey, where I grew up. So my mom died of the disease that you and I manage in an operating room or in a cath lab. And so it really kind of hit me in the head that what I was doing was really not the right way to do this. So I asked, was there a way I could have warned my mom a year, 2 years, 5 years ahead of time? Well, this was true back then. This is about 30-some years ago. It remains true today. People use cholesterol, which is an absurd concept. We should have discarded the idea of cholesterol testing a long time ago because there's superior technologies available. They've been available for decades, but they don't lead to a pot of gold for the pharmaceutical industry. That is statin drugs related things. But even back then, the only way to really identify coronary disease in asymptomatic people, you and me going to work, riding our bikes, going for a walk, whatever, not people in the ER with chest pain, having a heart attack, everyday people going about their business without symptoms. The only way back then, this is largely true today, was a CT heart scan for a coronary calcium score. And when you look for early coronary disease, you find it everywhere. It's everywhere. So a guy comes in, say he's 52, and he says, hey, my dad died of a heart attack at age 58. I don't know if that's in store for me too. He comes in, he's got a positive score, normal is 0. So say his score is 400. We help publish these data. If you do nothing, which is dumb, but if you did nothing, the score will be about 25% higher in a year. So about 500. Another year, 625. And big steps closer and closer to dying, having a heart attack, needing a procedure like bypass or angioplasty or something. We help publish these data. What if you put somebody on a high dose of Lipitor, a baby aspirin, a low-fat, low-saturated fat diet, and an exercise program? How fast does the score increase? 25% per year. That is well established. Oh. And to this day, as you know, my colleagues continue to call it optimal medical therapy. That hardly has any impact at all. And so what do you do, though, at the everyday level when you have thousands of people freaking out? So it took some years of trial and error, zigzagging, and you can do it. You can regress coronary disease. And there's been 2 real recent studies, the HEARTS trial and the EVAPORATE. The EVAPORATE was done by Matt Budoff, who's a pioneer in coronary scanning. And they showed that everybody in these trials, there's been a lot of debate about whether fish oil really works or not. It works. There's no question now. It works, and it has a huge effect. These 2 trials, very similar. used CT coronary angiography. That is a CT heart scan device, but you get X-ray dye, contrast dye, and you can see the details in 3 dimensions of the coronary arteries. Well, on these 2 trials, everybody's on a statin drug. Everybody, because that's the prevailing wisdom, right? And half given fish oil in some form. In one study, it was 4,000 milligrams of EPA alone. The other one was 3,360 milligrams of EPA and DHA versus placebo. And both trials showed something very similar. The people on statin alone had marked progression of disease over 18 months or 3 years in those 2 studies. And the people who got higher doses of omega-3 fatty acids had regression, but mostly of soft plaque, the soft elements and fibrous plaque. Not so much calcium, but most of the fibrous and fatty plaque. That's the stuff, of course, that ruptures and causes heart attacks, sudden cardiac death. So those 2 trials really kind of are the start of a new age where years ago, if we talk about regression, everyone thought we were nuts. But no, now it's bona fide. You can achieve coronary plaque regression. Now, the thing is with these trials, they were clinical trials. This is not a criticism. They could have gone further and addressed other cardiovascular risk factors, not cholesterol. It's a waste of time. But things like not just omega-3 fatty acids, but vitamin D. When you add vitamin D, that's when you see the calcium score also drop. And in this new age of the microbiome, if you address the microbiome, you see even more powerful effects.
Yeah, maybe let's talk a little bit about that microbiome, right? Because it's certainly not intuitive that, the stuff that's living in our intestines is going to affect our heart health. Let's maybe dig into that a little bit.
It's become clear. So in all the studies looking at this question, in condition blank, what proportion will test positive for SIBO, small intestinal bacterial overgrowth, the situation in which fecal microbes in the colon have overproliferated because we've lost beneficial microbes because of antibiotics and glyphosate and a lot of other things. So fecal microbes have overproliferated in the colon and then remarkably have ascended into the 24 feet of small intestine. So if someone does an endoscopy and aspirates some fluid out of the duodenum or upper jejunum, you can find fecal microbes in the upper GI tract. They're not supposed to be there, but in about 50% of the US population, they are there. And we know that probably 150 million people have this because there are dozens of studies asking this question. In condition blank, what proportion test positive for SIBO? Usually by hydrogen breath testing. How about irritable bowel syndrome? Of the 60 to 70 million Americans with irritable bowel, about 31% will test positive. That's conservative. Some studies show much more, but
positive for SIBO?
Positive for SIBO, positive for hydrogen gas on the breath. So if 31% of those 60 to 70, you're talking about 18 to 20 million people right there. How about obesity? Of the 115 million people in this country who are obese, 50% test positive. That's another 55, 60 million people right there. How about people with fatty liver? About 105 million people with fatty liver. 50% test positive. Go down the list. Coronary disease, atrial fibrillation, dementia, other neurocognitive disorders, autoimmune disorders. There's overlap, of course, an obese type 2 diabetic with fatty liver. But you can see the numbers add up very quickly, easily exceed 100 million people, and probably more like 150 million people. I didn't believe it. I didn't believe it at first until this thing came out. I have no association with the company. It's called the AIRE device, AIRE. This is the original that measures hydrogen gas in the breath. This is the more recent one, measures hydrogen gas and methane. And these are gases that microbes produce, but humans do not. And we can use these devices, it's called AIRE, AIRE, as a mapping device to tell us where microbes are living. So there's a little protocol we follow to do this. It's very easy, but it tells you, are microbes living in the 24 feet of small intestine where they don't belong? The important thing at least from heart disease and other perspectives, is when you have that situation of 24 feet of small intestine colonized by fecal microbes. So the small intestine is not equipped to deal with that. The small intestine is very permeable. So when those fecal microbes, trillions of them, die, they only live for a few hours. They shed some of their toxic components called endotoxin. And that gets into the bloodstream, endotoxemia. And that is how you increase cardiovascular risk and atrial fibrillation and cognitive impairment and risk for breast cancer and hypertension and rosacea and psoriasis and rheumatoid arthritis. In other words, we've got to rethink virtually all human disease in light of the contribution via SIBO endotoxemia to all those conditions.
And, this kind of brings in inflammation, right? Which we know is very important in the heart disease process. And one of those sources of inflammation, one of the potential sources of inflammation that's leading to the damage of the blood vessels is coming from what's going on in your gut.
Yeah, so this endotoxemia is a major amplifier of insulin resistance. We all know that people who have coronary disease are all insulin resistant. They're often type 2 diabetics, even if they don't know it, or pre-diabetic, or at the very least have a severe case of insulin resistance. That endotoxemia from intestinal microbes is a major amplifier or driver of insulin resistance. And of course, insulin resistance causes accumulation of fat in the abdomen, and that in turn is very inflammatory. So it's a vicious cycle. More inflammation, more insulin resistance, more inflammation in the coronary arteries and other arteries, amplifies the counts of small LDL particles, the real cause for heart disease, VLDL and small LDL. So it's a vicious cycle. But as you know, that's why our local hospital add on an $80 million new wing for cardiovascular disease, because heart disease remains the number one moneymaker for hospitals.
Oh.
And what do you think? Why do you think this is not widely acknowledged in the cardiology community, right? You've been doing this for longer than me, long period of time, and okay, cholesterol, fine, it got talked about and the medications come along and, it becomes a focus. But, it really isn't debatable, right? You look at all the studies that show insulin resistance, inflammation being much bigger magnitude risk factors than, LDL cholesterol is. And yet it just doesn't get talked about, right? It sort of, there might be some references to it and this and that, but it really doesn't get focused on. And yet it's obviously what's driving the ongoing epidemic, right? Because we've gotten pretty good at addressing the cholesterol issue, and it's not having a noticeable impact on heart disease. Like you said, the hospital there just built their new cardiology wing because cardiology business is still booming. Heart disease is still number one.
80 million Americans take statin cholesterol drugs, and it has had no meaningful impact on the incidence of cardiovascular events. Dr. Mark Hyman was recently offered a congressional testimony because of the problems in healthcare. He said something priceless. He said, American healthcare is not an evidence-based process. It is a revenue-based process. In other words, it's all about money. Heart disease makes a lot of money. And so it's hard to just turn it away. So the whole statin drug is just lip service to something easy to dispense and has a little bit of benefit. There's so much more people can do, like address endotoxemia. That's in the list. Omega-3 fatty acids, a very big factor. Vitamin D. These are all cheap and easy. That's the curse and the blessing. If something is cheap but wonderfully effective, most of our colleagues say, I can't be bothered. What's in it for me? And so there's a lot of that going on.
That's it's funny. Since we last talked, I remember, thank you for reminding me who it was who said that. I have repeated that revenue versus evidence-based medicine, I don't know how many times. To me, it makes as a layman, it's the thing that makes the most sense. I think I'm past the point of being furious. I think I'm now just simply, I've run out of patience for people who don't get it, that most of what we've been told about taking care of these chronic diseases is just about making money. So let's move to solutions. Let's solve this issue. Clearly, the pharmaceutical industry isn't going to do it for us. What do we do?
I have a basic philosophy that's served me very well, and that is, and it's confusing. It's very confusing to everyday people.
I think he's being sarcastic. I'm guessing.
No, this is true, Jack.
This is true. Okay.
Yeah. Let's get away from the idea of treating conditions. High blood sugar, treat it with insulin or another drug. High blood pressure, treat it with a blood pressure medication. Instead, let's address the factors that allow coronary disease, atrial fibrillation, hypertension, depression, suicidal attempts, panic attacks, rosacea, all those things. Let's find the commonalities that you can address, and all those conditions go away. So we have to talk about, a lot of this is reverting back to the lifestyle programmed into our genetic code. So you need vitamin D. That's just a reality. We're supposed to get ultraviolet radiation by living outdoors in a tropical sun, wearing a loincloth, and running around and spearing things. Vitamin D, omega-3 fatty acids, because we're supposed to kill that animal and eat its brain, rich in DHA. And of course, get fish and shellfish, rich in EPA, DHA. We can't do that now, right? Mercury and cadmium exposure. Iodine. People have forgotten that iodine deficiency was a worldwide epidemic until about 1924, when the FDA said, put iodine in the salt and use more salt. And it worked. The diet followed by hunter-gatherer populations, like in the Brazilian rainforest or the highlands of New Guinea. There is no coronary disease. There's also no hemorrhoids, no colon cancer, almost no cancer at all. Cancer is rare in those populations. No hypertension, no ulcerative colitis, no Crohn's disease, no irritable bowel syndrome. So we've done something that allowed these diseases to emerge. How do they eat? They kill animals, they fish, they grab birds' eggs, they dig in the dirt for roots and tubers, they gather occasional wild fibrous fruit. They eat the way humans are supposed to eat, with needs programmed. I tell people, imagine you saw a lion kill a wildebeest and tear open its abdomen and eat the intestines and go to the heart, and you're disgusted. So you say, we're going to capture that lion and put him in a cage and feed him kale and spinach.
Oh.
The lion's dead within a few weeks, right? In other words, there's a very specific style of eating programmed into that creature's genetic code. We're no different. We have a specific style of eating, and that style includes no wheat, grains, or sugars. Those are only recent additions to the human diet. And that, by the way, is the driving force in coronary disease. It's the amylopectin A of wheat and grains, as well as sugars, that drive formation. It drives a liver process called de novo lipogenesis that produces VLDL particles, very low density lipoproteins, that in turn lead to small LDL particles. That's the cause for coronary disease. It has nothing to do with cholesterol. And yet we have American Heart Association, U.S. Department of Health and Human Services, the Academy of Nutrition and Dietetics. They all agree you should eat wheat and grains every day, every meal, something that triggers formation of small LDL particles. They're advocating a diet that causes heart disease. So doing the opposite, never limit fat, never limit calories, eat no wheat or grains that trigger formation of small LDL. Let's address those common nutrient deficiencies, vitamin D, iodine, omega-3 fatty acids, magnesium. Those, by the way, synergize to minimize insulin resistance that drives small LDL and inflammation. And then we go
I want to pause right there because, my role here is to listen for things that will help the average listener. You said iodine, vitamin D, magnesium, and
let's say omega-3.
Yes, synergize to help. What I heard was that if you have some element of insulin resistance going on, it helps to offset that or recover from that. Did I hear that right?
And these are all needs programmed into the human genetic code. Omega-3s are not optional. You can die if you don't get them. And most Americans have miserable intakes. The vitamin D, you're supposed to get it from sun exposure. Iodine, you're supposed to get it from eating the thyroid glands of animals and or living coastally near the ocean where all the iodine is. Magnesium is supposed to come from drinking water and from wild plants. We have to filter water because there's sewage, and farm runoff. So you have to filter the water, and water filtration is very efficient, moving all magnesium. So all we're doing is replacing things you lost. In the microbiome, we replace microbes that are lost, especially two, Lactobacillus reuteri and Lactobacillus gasseri, because those are two species that colonize the small intestine and produce bacteriocins, natural antibiotics effective in killing invading fecal microbes. And you get a reduction in endotoxemia, dramatic reduction in endotoxemia, a cardiovascular risk factor and risk for other diseases. So, and all we're doing is restoring all those things that you're supposed to have. Your mom, you were supposed to have gotten reuteri and gasseri from your mom when you passed through the birth canal a few years ago, or breastfeeding. But mom probably got antibiotics, you got antibiotics, and we wiped out those lactobacillus species. Restore them, and by the way, our shared interest is cardiovascular disease, of course. I think endotoxemia is going to be at the top of the list as a driver of cardiovascular risk in many forms. Coronary disease, perhaps some forms of cardiomyopathy, atrial fibrillation, and maybe some other dysrhythmias. But I think we're going to be hearing a lot more about endotoxemia as a factor, as a cardiovascular risk factor.
Is that something that you test for, that people can test for to figure out if this is an issue for them?
Mm-hmm. So two things. You could formally test like this, the AIR device, or you can have it done at a lab or clinic. This is $150, $200, and you can use it over and over, and you can share it with your family if you want. Not with friends. It's like sharing a toothbrush, So that's one way you can test. And there's a specific protocol. It's very simple. 0 to 10 talks to your smartphone and tells you whether you're producing hydrogen gas. But you don't have to do that. I call these things telltale signs. If you have telltale signs of SIBO, you know you have endotoxemia. And these are signs like fat malabsorption. You can see fat droplets in the toilet. That's a sign of SIBO, because fecal microbes in the duodenum block the action of bile and pancreatic enzymes. Conditions that are almost synonymous with SIBO, like fibromyalgia, irritable bowel syndrome, inflammatory bowel disease, restless leg syndrome, those are extremely highly, obesity.
Restless leg syndrome.
Yeah, isn't that weird? All these food intolerances that people talk about, I can only eat 8 foods, all those people, those are all SIBO. So food intolerance to nightshades, FODMAPs, legumes, fructose, even a lot of lactose intolerance. These are all forms of SIBO. The problem is not the food. The problem is this disruption in the gastrointestinal microbiome, but specifically invasion of the small intestine by fecal microbes and the endotoxemia that accompanies it.
I'm putting this into terms I think I understand. And it's crazy because we've talked a lot, and the penny is just starting to drop. I may not be the sharpest tool in the shed. That's my role here. Your problem is you got poo coming up into your small intestine, and poo's only supposed to be in your large intestine. If you've got the right bacteria in your small intestine, it'll take care of the problem. But you don't. So have I put it in 8th grade terms that make sense?
Yeah. More recent DNA methods have told us that microbes are everywhere. So if somebody gets their gallstones taken out and you DNA sequence the microbes into gallstones, it's full of fecal microbes. People with pancreatic cancer, if you look at the microbes in the cancer, fecal, what are they doing there? The pancreas, the gallbladder are 24 feet up from the colon where fecal microbes belong. 24 feet, 3 times the height of your ceiling. Those microbes have climbed. So in other words, many signs tell us that fecal microbes have invaded the small intestine. Now, that's the bad news. The good news is I'm seeing about 90% success rate in eradicating SIBO and thereby endotoxemia with restoration of Lactobacillus reuteri and Lactobacillus gasseri. I think it's their loss from antibiotics and other factors that probably caused this incredible epidemic of SIBO. But just restoring them, so far, of about 50 people we've done this with, 90% convert to H2 gas negative. and have all the benefits of eradicating SIBO, like weight loss, release of abdominal fat, reduction of blood pressure, better control over recurrent bouts of atrial fibrillation, reduction in C-reactive protein, on.
AFib. Okay, this is a highly specific question, but I know there's people out there that are going to relate to this. My dad had a colonoscopy very young. It was, I want to say 30, 31, lived his whole life without his colon. And he suffered, amongst the cardiac issues he suffered from was atrial fibrillation. Is it your guess that was related?
As Dr. Ovadia, there's more to AFib than just endotoxemia. There's other factors. Probably glycation is probably a driver, other bad habits in life. So it's not only endotoxemia, but it's become clear that endotoxemia is a driver. And it's something that is not typically addressed. The cardiologist doesn't give a shit, right? He's not going to address the gastrointestinal microbiome. So this is a problem. A lot of people, this is why I like what you guys are doing. We are people who go outside of our primary area of interest. Here we are in heart disease talking about the microbiome, but you have to. You can't say, that's not my job, or diet's not my job, talk to the dietitian, right? You can't do that anymore if your interest is having control over these various conditions. But atrial fibrillation is clearly, to some degree, a consequence of endotoxemia. As you know, people with atrial fibrillation also have atrial fibrosis. So there's probably more to it than just endotoxemia.
My dad just had a laundry list of physical issues. I take great comfort knowing that I come from incredibly hardy stock, because as many things as he had wrong with him, he lived into his late 70s and probably should have been dead 50 years earlier, but he was just too tough to die. Okay, so I'm guessing that I've got your book. I've started reading it, and I'm going to speak to our audience real quick. Dr. Davis is a really good writer. A lot of times, these things are a pain in the butt just to read. You won't have that problem with Dr. Davis's book. Let's talk about the specifics. I'm guessing that there is both things to stop doing and things to start doing. You talked about what else are we? And I realize this is a 1-hour podcast. We're not going to be able to give people the keys to the kingdom in this one shot, but how do we at least get started on the road?
So those common nutrient deficiencies, vitamin D, magnesium, iodine, omega-3 fatty acids, very important. And now with recent evidence I mentioned early on, omega-3s are clearly a driving factor in achieving regression or reversal of coronary atherosclerosis. Addressing endotoxemia and SIBO with those two microbes. You don't have to have SIBO to enjoy those two microbes. We make a yogurt out of it. It's not yogurt. It looks and smells like yogurt, but we ferment reuteri and gasseri. Optionally, you can use Bacillus coagulans or Bacillus subtilis also, but those are optional. We ferment them for a prolonged period, 36 hours. Reuteri microbes don't have sex, right? There's no mommy and daddy microbes. They just double themselves. Reuteri doubles, for instance, every 3 hours at human body temperature. So we're going to ferment it for 36 hours, 12 doublings. We did flow cytometry to count the microbes. There's about 300 billion per half cup serving. You consume that, and over 4 weeks, about 90% of people will test H2 negative, or whatever symptom is coming from SIBO and endotoxemia will go away.
Okay, you're using long chemical names. This is not like something I go on Amazon and buy a bag of L-reuteri, I don't think.
Just in my Super Gut book, I tell people where to buy them. These are commercially available.
Oh, really? I haven't gotten to that yet. So, okay.
Because we have to be careful what strains we use. Not all strains work. We're exploring this. We did a small mouse trial comparing various strains of reuteri to see but so far, the ones we've tested seem to work. So there's 200 strains of reuteri. We don't know which ones are better. So that's a work in progress. But I do list where to get the sources of reuteri in the Super Gut book. It's also in my blog. I have several thousand posts in my blog. It's in there too. But we make this yogurt, prolonged fermentation, and get those super duper high counts. Now, here's where it gets a little more complicated, because one of the things I've been fussing with lately is this idea of body composition. shape and body composition. You know, modern people have expanded their abdominal fat, their abdominal visceral fat, that is the fat that encircles the abdominal organs like the pancreas and intestines, which is distinct from subcutaneous fat, fat below the skin. It's really the visceral fat, the abdominal visceral fat, that is the source of most of the problems. And even more remarkably, people who have abdominal visceral fat are now being found to have something called ectopic fat, that is fat in other parts of the body where they're not supposed to be. So, for instance, you can do an MRI of your knees or hips if you have abdominal fat, and you can see globules of fat in the joint. And that accelerates deterioration of your cartilage. You can get fat in your pancreas, which damages the cells, the beta cells that produce insulin. It can convert a type 2 diabetic to a type 1 diabetic. Of course, you can get epicardial fat also that accelerates coronary disease. So this is a big problem. And so, unfortunately, this silly world of the GLP-1 agonists like Wegovy and Ozempic, so these are horrible drugs, but the FDA approved a class of horrible drugs. So
First time in history that has ever happened.
Yeah, I was going to say another class of horrible drugs.
So let's say your wife pays $12,000 for a year's worth of Wegovy. She loses 40 pounds. She's real happy. She's down to a size 8 or whatever. Of those 40 pounds, 30 pounds was fat, 10 pounds was muscle. And it's that 10 pounds of muscle that is a landmine. So she stops the drug because most people can't afford that forever. She regains 32 to 34 pounds of fat, more than she had before, does not regain the muscle. And even if she maintains a low-calorie diet and a vigorous exercise program, she will regain all the fat, all the weight as fat, not as muscle. And she's also accelerated her death by several years. There's increased mortality from this effect. And she's more likely to spend the last few years of her life frail, falls, fractures. But this costs the American taxpayer and the consumer a huge amount of money to fund pharmaceuticals activities that destroy health.
There's a part of me that wants to just stop, clip this last 3 minutes and put it on a loop and just play it everywhere all the time. I want to reiterate what I heard you say. The GLP-1, these artificial GLP-1 agonists, they definitely help you lose the fat. That's good. The problem, amongst the problems, is you're going to lose muscle. That's not optional. And in order to keep the fat off from that point, you pretty much have to be on these things for the rest of your life.
Yes. So you're essentially held hostage. I did a little clinical trial and made an unexpected discovery. In my audience, largely ladies, and they love the reuteri because in addition to colonizing the small intestine and reducing endotoxemia, it also sends a signal to your brain to release the hormone oxytocin. Many people recognize oxytocin as the hormone of love and empathy, but it's also the hormone of body composition. This is fairly new stuff. So,
Yeah.
but the ladies all say, "Oh, we don't care about that. We just want better skin." Like, what? So I did a small clinical trial, 25 ladies, big ladies, and they got Lactobacillus reuteri. They got Lactobacillus reuteri, and I threw in other things to stack the odds in favor of favorable skin effects. Marine source collagen peptides, hyaluronic acid, both of those things, by the way, lacking because people don't eat organ meat anymore. And they were used to get collagen and hyaluronic acid. And then the carotenoid astaxanthin, because most people live on fast food and processed food and ultra-processed foods. They don't get carotenoids. So I had these ladies do that over 90 days. We measured the thickness of their dermal layer of the skin. That's where skin health and beauty occurs, the dermal layer, just below the epidermis. And we recorded a dramatic increase in dermal thickness. The ladies were thrilled because they lost their crow's feet and their smile lines, and even some of the deeper wrinkles started to recede. But I also happened to measure waist circumference just because it's free. And these ladies lost huge amounts of waist circumference, up to 8.5 inches. But they didn't lose weight. Now, how can that happen? How can you lose up to 8.5 inches off your abdominal fat, but not gain weight and not lose weight?
Replacing fat with muscle, maybe?
Restoration of youthful muscle. So that's what we're seeing. So now think about that. So GLP-1 agonists, you're losing huge amounts of muscle and regaining more fat. Here, I stumble on a way, I did not expect this. I stumble on a way to target abdominal fat and bring back youthful muscle. When I did it personally in my about 5 years ago, in my early 60s, I gained 13 pounds of muscle over 3 weeks, and my strength increased by 50% in my early 60s. So these are all oxytocin effects. So because you boost oxytocin with restoration of reuteri using this yogurt, you get a restoration of youthful muscle. You get smoothing of the skin. That's why the ladies get all excited. There is all the effects of empathy, generosity, acceptance of other people's opinions, oxytocin. There's an increase in libido.
That's right, folks. Dr. Davis just said the political problem in our country is SIBO. I may have made a leap there, but
I think a lot about this. Think about this. So we live at a time of record social isolation, even pre-pandemic, record suicide. Suicide is increasing very rapidly. Divorce, half of all marriages end in divorce, and the rise of narcissistic behavior. Not my speculation. The psychology community has been formally testing for measures of narcissistic behavior since 1963. And the slope looks like that, 45-degree increase, 1963. True or false? I am a very important person in this world. Back then, 1963, 13% of people said, oh yeah, I am. Our time, 83% of people say that. Now, there may be more to this than just loss of reuteri and oxytocin, but I think what happened is I stumbled inadvertently on a way to make people better.
I think
testosterone.
That's worth digging into. And we know, I mean, it is unequivocal that for the last, I'm going to say 40 years, the quality of our food supply across the board has absolutely plummeted. And what we've been exploring on this show is the physiological effects of that. What's happened, how to reverse it, what to do so you don't suffer from it anymore. But we haven't really spent much time. We've had Dr. Chris Palmer on, and that's been fantastic. Dr. Georgia Eade. Those two have definitely tied our nutrition to mental health. But holy smokes, what if it really is? If we could just, as a nation, get back to nutrition, we'd stop being such a bunch of assholes to each other.
I think about that because I think a lot of anger and hatred is due to the loss of reuteri and thereby this hormone oxytocin.
Well,
so
if you feel crappy all the time, you're not going to have patience. I mean, anybody knows that.
What's a real lethal combination is the loss of reuteri and SIBO with endotoxemia. And along with SIBO, you can have SIFO or fungal overgrowth. And fungal overgrowth is very common. It's a major driver of hatred. So imagine
fungal overgrowth is a major driver of hatred.
Of frustration, irritability, and hatred. Yeah. So think about that. This is a very, very common situation. Loss of reuteri, thereby oxytocin, SIBO, endotoxemia, and fungal overgrowth, or SIFO, small intestinal fungal overgrowth. That is a lethal combination. So in all our future clinical trials, we're going to do baseline and follow-up psychological profiling for measures of well-being and happiness and anger and frustration, all the kind, because I think we can show, not to say that doing this is going to solve all the world's problems. Of course not.
Sure.
But it's something we can do something about.
Yeah.
Yeah. And it's, it's so amazing to think about this. Just again, we've gone from the gut to the brain to the heart to the, and all these things kind of work together. What would you say to people? So we talk about all these different aspects of health and all these different potential root causes of all of these chronic diseases, right? And if someone's sitting there and they're thinking, okay, I've heard about insulin resistance and metabolic disease, and, we're talking about the microbiome, and, maybe I got some other people that are talking about, that I'm not getting the right type of light or, enough light, enough sunlight, all of that. How do you recommend to people that they start to put it together, right? If the person is there and says, I'm sick. I know that I'm sick. All my doctor has said is, take these medications, and I want to get beyond that. I want to do something different because I know that's really not addressing the problem. Where do they start with all of this stuff?
I could selfishly say, read my books or follow my programs, but all we're doing is restoring factors that you should have had all along, or correcting a situation that went wrong. Like SIBO, you shouldn't have SIBO, but restoring the microbes you've lost, reuteri, gasseri, and some others, gets rid of it. And you restore better gastrointestinal health. Fermented foods are also very important. All those nutrients lacking because I agree with the use of light. So this is my device I use for infrared light, because I'm in suburban Chicago, as you know, and it's been gray and cold for the last week, and I can't get outside. At least not pleasant, but at least to have some pleasant exposure to the sun. So it's reverting back to all the things we're supposed to be doing. The diet we're supposed to follow is what they'd do it as hunter-gatherer societies, not processed foods in a clamshell, all that stuff. So all we're trying to do is revert back. And this is played out in hunter-gatherer societies, the few remaining populations. They have other problems. They have nematode infestations. They kill each other. They have infections. They get bitten by mosquito and get malaria. But they don't have any diabetes, no obesity, no coronary disease, no stroke, no ulcerative colitis, no colon cancer, no pancreatic cancer. All the stuff that remarkably, anthropologists to this day call those the diseases of civilization.
Yeah. I just want to say parenthetically, when we first interviewed you, however many years ago it was, my wife had about the same time, completely unrelated to the interview, picked up your book, Wheat Belly. One thing led to another. We started making yogurt. And I want to speak to the audience. Folks, if you make the yogurt Dr. Davis talks about, I think it was in Wheat Belly. Did you talk about yogurt in Wheat Belly?
No.
Okay, it must have been something else. I don't remember.
But
But
the one that's got the yogurts in it.
the yogurt is so good. Oh my God. And if you make it in a sous vide at what temperature do we cook it at? 99 degrees. We cook it at 99 degrees for 36 hours. Oh my God, you would think you were eating the world's richest gelato. It is fantastic. Okay, back to our regularly scheduled program. Bill, yeah.
Yeah, I was going to say, so where do you think we're going, right, on the bigger picture? Here we are, and we're recording this. It's a couple of weeks after the election. There's lots of discussion around, health being a central focus of the new administration moving forward, or the old administration that's coming back, however you want to say it. But, it's great that we have health as a forefront in the national conversation. Where do you see that leading? What would you say needs to happen for us to really start to turn the ship around? It's pretty clear we can't keep going the same way we're going, because it's literally bankrupting our society. We don't have enough healthy people to serve in the armed forces anymore. All of these issues that are real big societal issues. What would be some of the ideas that you have as to how we turn the ship around?
I don't have a full answer. I'm not an expert in healthcare. That is the business of healthcare. Oh, I agree. Things have to change. The pharmaceutical industry has to stop their predatory practices. Our colleagues have to stop predatory practices. But the good news is, so all the things I do, you can do on your own. You don't really need that functional medicine doctor. You don't need the primary care doctor. If you want to restore reuteri, make yogurt in your own kitchen. If you want to restore vitamin D, you can probably do it better than most docs anyway. You don't need a doctor to dispense omega, even though the pharmaceutical industry has worked hard to make omega-3s a drug. It's a food. It's a component of food. Right? I tell people, imagine we said eggs are good for you, and they are, but you're only allowed 1,000 milligrams. But the average large egg weighs 60 grams. That's how they treat fish oil. So you don't need the doctor to write you a prescription for Vasipa or Lovaza. Just get it from Costco. Vitamin D, iodine. All these things can be done on your own. That's why I wrote the book Undoctored in 2015, because it became clear, not present company excluded, but somebody goes to their primary care doc and says, hey, I want to be healthy. They say, you need Lipitor. Or are you taking your baby aspirin? Or you need a colonoscopy. But you say, no, I just want to be healthy. The doctor has no idea. By the way, probably the best way to prevent colon cancer is to, one, correct colonic dysbiosis and see if you have Fusobacterium nucleatum in your mouth. So that evidence has gotten very strong that if you have Fusobacterium in your mouth, because you have bleeding gums, gingivitis, or periodontitis, it enters the bloodstream. Maybe some swallow, but mostly in the bloodstream. And it colonizes your colon, where the evidence is very good. It causes colon cancer. So why is the gastroenterologist only interested in doing a colonoscopy, but doesn't counsel you on how to correct colonic dysbiosis and your oral microbiome? So I think a lot of these things are going to come from us.
Yeah.
We are facilitators of information, of disseminating information to help people do it on their own.
Yep.
I'm on Medicare, but I only take Part A because I will never take a prescription from a colleague for cholesterol or blood pressure, because we don't need it. Because all those conditions go away, just like hunter-gatherers, when you correct all those things wrong in modern life. It's the best, as best as we can.
This is a side path that the thought keeps coming up as we've been walking through this. Iodine. What are some of the signs that you're lacking iodine?
So this all came to a head in 1924 because about 20 to 30% of the population had goiters and large thyroid glands, sometimes disfiguring. So if your great grandma was around, Jack, you say, hey, great grandma, tell me about goiters when you were a little girl. She'd say, Jack, you wouldn't believe it. My next door neighbor died at age 14 of a goiter. It crushed her windpipe, or myxedema. She had such bad hypothyroidism that she gained 100 pounds, couldn't get out of bed, and then she died in a coma. So this was a huge epidemic. If you go to Rome or Paris and go to the museums, look at the statues. A bunch of them have goiters. So this was a huge problem till it was figured out that it was a lack of iodine. And then in 1924, much of the U.S. population was illiterate. Of course, there was no internet or TV or radio. So there was a poster campaign. Use more iodized salt. Keep your family goiter-free. This is true. And so everybody started using iodized salt. It worked. It was one of the greatest public health campaigns and successes of human history. But then in the 1980s, when they started talking about cutting your fat and cholesterol and all that stuff, when you cut your fat and cholesterol and weigh your diet more heavily in favor of carbohydrates like grains and sugars, you get insulin resistance. And insulin resistance causes sodium retention. The FDA interpreted this as too much salt.
Too much salt.
It was insulin resistance. So that they tell us cut our salt. Now the American Heart Association recommends 1,500 milligrams of sodium, which the evidence is quite good, increases the death rate. This is the nonsense we have to deal with now. So what we do is salt your food and water. In fact, I learned years ago when we have people begin these programs. So no wheat, no grains, no sugar, vitamin D, magnesium, omega-3 fatty acids, iodine, address the microbiome. People were passing out because their blood pressure was too low, because they were on blood pressure medications. So we had to tell people, talk to your doctor, taper your blood pressure medications down. Some have to be weaned. They can't just be stopped. And salt your food and water. You have to salt your food and water or else you can have low blood pressure. Mm-hmm. So a lot of conventional wisdom gets flipped on its head when you start to ask tougher questions.
As always, Phil, I'm just trying to be mindful of the time. You've got about 5 more minutes.
Yeah, I just wanted to ask one follow-up on the iodine. I guess, so we typically will tell people that you don't want the iodized salts anymore because it's kind of processed food, essentially. They have to, the way they make salt these days is they take all the good stuff out of it. They take all the minerals out, and then they try and add some stuff back in. And, iodine is one of those things that you add back in. So for someone who's not using a table salt, a processed salt, they're getting the good sea salts, will there be iodine in there, or where else should people be looking to get iodine?
2 basic sources: seaweed, kelp tablets, very inexpensive. or potassium iodide drops. Both work quite well. The whole RDA for iodine was arrived at by asking this question: what dose of iodine do adults need to not have a goiter? What if it was a better question? How about we say, what quantity of iodine is required for optimal thyroid function? I think that's probably more towards 300, 350 or that range of iodine. So that's what we do with kelp tablets or potassium iodide drops.
Very good. Yeah, this has certainly been a fascinating discussion. Always, like I said, amazing to think about all the different areas that we hit upon when we're just trying to keep our hearts healthy and keep our health optimized overall. And definitely highly recommend Dr. Davis's books. Lots of great information in them. For people that are looking to learn more, connect with you, where can they go?
So my Super Gut book, of course, the most recent book, my blog, williamdavismd.com. There's several thousand posts. I have a membership site where we do this and talk both ways. The Super Gut book has all the recipes for all the yogurts we make. I also formulated some products where you can use them as starters to make these yogurts. So that the website is oxyceutics.com, OXICEUTICS, oxyceutics.com. And you can get, for instance, the reuteri. You can take it as a probiotic, or, probiotics get expensive. So we can make yogurts out of these things, and you can share it with your family and friends, and it's very low cost to do it that way. And you get those super duper high counts, which can be important, say, if you're battling SIBO and you're just starting out and you want hundreds of billions. Ferment them as a yogurt, and you stack the odds in favor of eradicating the SIBO.
Love it. Once more, folks, the yogurt is amazing. Absolutely amazing. I really enjoy these chats. I'm also really glad that I have transcripts of these things available so that I can go back and reread, because it's like drinking from a fire hose every time I talk with you. And I suppose our listeners probably feel the same way. But folks, the good news is you can press the rewind button and go back and listen again. All right, Phil, it's been awesome.
Yep, always great chatting with Dr. Davis. I look forward. We'll have to make sure maybe not to make it 2 more years before we have him back on, get him back on sooner than that. But always great talking with you. And I'm sure that people learned a lot from this. And
I learned a lot.
Yep.
I've interviewed him 3 times now, and it's finally starting to soak in. All right. For Dr. William Davis and Dr. Philip Ovadia, this has been Stay Off My Operating Table. Thanks for joining us, folks. All the contact information will be in the show notes. You can find it there, and we'll talk to y'all next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.